Okay, we're live.
All right. Hello.
Hello, everyone. Welcome to episode number 9 of Elite Extra, Extraordinary Life Support for People That Lead Extraordinary Lives. Today we're going to be talking with performance coach Beth Richmond. I put in the title about her unique brilliance. So that encompasses a lot, sort of how she got here in her career and the type of clients that she enjoys working with and who benefit most from her unique set of skills, experience, and knowledge. Have anything to say before we get started?
No, just
Okay.
hi. I'm looking forward to this.
All right, great. So let's just start. Tell me a little bit about your history, before your professional career and how you got to this field.
All right. Well, I think it all started as just coming from an athletic family. We were always in sports, so I always loved just moving and doing anything possible. And then I was also a high-level gymnast, and so that turned into being a gymnastic coach as well. And I coached a high school team and owned my own club for a few years. And within that, I always was training my gymnasts and also unfortunately having to deal with some injuries, repetitive use injuries, things like that. So I worked very closely with doctors, physical therapists, and athletic trainers. And that sparked the interest of physical therapy for me. So I did go back to school for, the PT assistant. And then I was working in the field for about 10 years. And at that point, I met Brad. And so Brad is one of the owners here at Elite Health Services. And
My co-host, Dr. Brad Gill.
Yeah, and heads up the physical therapy department. So I was working with Brad for many years, and at that point I went out on maternity leave.
This is before Elite Health Services. Yeah.
Yes, before Elite Health Services,
Yes.
Thank you. And then I went out on maternity leave. Took 10 years on maternity leave, and Brad just kept calling me up and saying, hey, listen, I have this ideal position for you. He's like, I'd love to use your PT skills, but apply that to training clients, so combining the PT and the personal training. And so that's kind of how, I came here to be here at Elite. Yeah. And I've now been here for over 6 years doing that.
And you got kind of the ideal pedigree and career path for what we do here, because we do have people that have challenges and I didn't learn this for the first time today, but it's good to be reminded of your history of being an elite gym, and I think I learned how to say gymnast today. You're very specific about that. Gymnast doesn't work?
I think it depends.
Okay,
it can go either way.
But you being an elite gymnast and a coach
yeah.
and a business owner, like you're the authority.
Yeah.
I forget that you owned a business and you did have to coach high-level athletes who were dealing with repetitive injuries and traumatic injuries.
Yeah.
And I forget about that part of your past.
And that was like at such a young age, which was amazing that, I had the courage to do all that too. And so, obviously life takes you in different pathways, and so motherhood took me in a pathway for a little while, and
that taught you patience.
Taught me so much.
Humility and other good values that we practice around here.
Yeah,
wow.
No, all that. So
well, you're doing great.
Thank you.
So what type of clients do you currently train now, sort of being in this ideal position with Elite and your background?
All right. Well, when I first came here, I was kind of hired to, it was like a hybrid position, and it was to work with clients that were still in therapy or maybe post-therapy, so post-rehab, but they were more, what do I want to say, needed more of a critical eye and that therapy background to take them through some exercises and use some therapy skills. So the clients were like acute or chronic low back patients that also needed the exercise component. Clients that had neurological diseases that, again, you're still taking them through a full body, but just having the understanding of how that disease may affect their system.
Can you give me an example of some of these neurological conditions?
Well, there's definitely from MS to Parkinson's.
Okay, yeah.
Then there's, some like undiagnosed neurological diseases that doctors can't put a name to, but it's there.
And they know exercise benefits these patients.
Yeah, definitely. To clients that have connective tissue disorders, so something like fibromyalgia or Ehlers-Danlos, which is just a connective tissue disorder, leads to a lot of similar symptoms as fibromyalgia, but you're also very hypermobile. And so working with clients in that, working with clients and taking them through a full body training session.
Okay. And lately, who you've been working with?
Well, lately now, as I'm making, or I have made the transition, and so PT and training, very similar in many ways, but, I've had to take some different courses that would connect the two, so weight training courses. So that has allowed me, by doing that, has allowed me to train higher level clients. And I could have the weekend warrior, I could have somebody who is a triathlete or just a runner, competitive runner, a tennis player, things like that, or just the person coming off the street who does not have any major issues, want to come here, they want a hard workout, they just want to come and get pushed and have fun. And so those clients I really enjoy working with as well.
So tell me a little bit about the different ways that you approach someone who is still in their course of treatment, a physical therapy, let's call it patient, who's being transitioned to a fitness environment, and your approach to someone who comes like off the street, we say, who is not in need of medical assistance at the moment. What's the difference between the approaches with those two types of clients?
Well, many of the clients coming out of therapy have this fear factor that's holding them back. They're afraid of getting re-injured. So the biggest thing is you got to gain their trust. They have to feel confident in me and my skills, and that I'm not going to then hurt them or push them beyond their limits. So that's one thing. The other thing is really a lot of people just need to learn how to move a little bit more properly, and that's an area of specialty of mine, is looking at their posture and how they move and making sure that they are in proper alignment and the timing of their movement is proper, and that they're connected through their base of support and their core. And so then just looking at that actually relieves a lot of the pain, that just putting them in proper alignment and getting them to use their body correctly almost eliminates that pain, because they're in proper position, and then getting them to move, doing the exercises. So that's, again,
so that's
the
the patient, that's the person coming out of therapy.
Yeah, that's the patient coming out of therapy.
Okay.
Yeah. Yep.
And how about the person off the street?
Well, you have to take them individually, because again, coming off the street and walking in here, everybody's entering the gym for a different reason. So we would sit down with them and go through like an interview and find out the reasons and their goals and what they're looking for and what their past experiences. And then from there, I would develop their first session according to what they talk about.
Now, is it easier because they don't have some specific joint that we need to work around, or that you don't have to re-educate their sort of multi-joint movement mechanics, sort of teach them how to protect themselves?
Sometimes it is.
Yeah.
I like the challenge of both. I like the challenge of looking at a client, and like I always compare them to peeling away, the layers of an onion. You work the first layer, and every time you see an improvement, you keep just going until their body is more efficient and they're moving, again, correctly. But yeah, somebody coming off the street that has no major issues, sometimes you can, take them further, faster, and do different things. So it can make it fun.
Yeah. Okay.
Yep.
So not necessarily easier.
No, not easier, just different.
So how is your specific experience working as a PT assistant in a dedicated rehab setting before your time at Elite? how do you use that skill set here at Elite when you're working with patients that are being transitioned to a fitness setting? You know, not just trying to get them back to like discharge, getting back to their lives, what we might call a baseline. How do you use your skill set from your, you know, your previous position to get somebody to the next level of performance? Is the word we like to use.
Yeah, I'm trying to think, like,
your specific skill set. I know you use your hands a lot.
well, I have the manual therapy background, so that goes along with the manual therapists here all have a certain, you know, they're certified functional manual therapist, you know, training. And so I have like 4 courses, or, you know, half of that training as well. And so as a PT assistant, you know, I have the skills to use manual therapy. So manual therapy could be some soft tissue work. So if somebody comes in and they have just chronic ITB tightness, they don't really need physical therapy, but they have this tightness. So, you know, as a trainer, you could use some foam rolling to address it. From my skill set, I can go in, use a foam roller, but I can also use my hands to do some soft tissue work and some patella mobilizations to free up that knee to get rid of that tightness. So that's, you know,
so yeah, that's
one skill set.
That's definitely something that the rest of the performance coaches here, you know, all performance trainers at Elite have extensive on-the-job training to manage people through our physical therapy, discharge to fitness protocols, which is, you know, a lot of manual training. But Beth definitely has some unique skills in being able to do very specific joint mobilization, soft tissue mobilization, stabilization exercises, and PNF. You know, PNF is like jargon, right? Like, you know, proprioceptive neuromuscular facilitation. To our average customer, they don't care what that means. But tell me about how you use your hands to help someone move more efficiently or properly.
So typically in the training setting right now, it's either to use like at the scapular girdle or the pelvis. And it's kind of applying, like using my hands, applying a specific amount of resistance to elicit a response from the body. So the client doesn't need to think about it. They can't do it on their own. So I apply the resistance to elicit that. And then in the direction of the movement that I need the scapular girdle to set or the pelvis to move. And again, it's all without the client's conscious control. So it's teaching the body how to move.
It's like reprogramming the nervous system,
So
and dummy proofing it.
And you can do that, you know, like I said, at the scapular girdle, at the pelvis, but then also you can use it to get a core activation. Because sometimes somebody can't just kind of activate that core on their own, so you use skills, manual skills to do that.
Yeah, and I've been on the receiving end of those skills. They're amazing. Sometimes I have Beth train me, and I've had some, you know, a bad clavicle break, and she really helped me use that extremity better by using that PNF technique. Because I couldn't think my shoulder blade into the right position, so she used her hand, and it was really cool.
Thank you.
Humbling. So tell me about the continuing education focus you've had recently since you've been at Elite.
Yeah, so, you know, I do always love to continue to learn, and I think in today's age with, or day and age with the medical field, and also even in training, the world is changing, you know, the information's changing or whatever, but I like to learn. So the courses that I've been taking is one, you know, some weight training courses always, and then the MELT method, and then recently I've been focusing in on women's health. So there's a training and coaching women specific certification, and there is a pre and postnatal certification that I'm currently working on as well. And then also both of those have an emphasis on like the connection of the pelvic floor and the core. And so that ties in really well here at Elite because we have you know, a couple of the therapists that specialize like in that, you know, some women's health issues and the pelvic floor. And so a lot, you know, most of the people coming in here to train, whether they're coming out of our, you know, physical therapy department or not, usually has, if they've had children, some form of kind of like pelvic floor issue, or it just from childbirth got turned off and never kind of turned back on. And so I think becoming that as part of my specialty is going to just enhance the training of my clients.
Being a mom.
And being a mom and understanding
you've been through it.
I need it myself.
Yeah, right. Yeah, we teach you what we need to learn, right?
Yeah.
You mentioned the melt method.
Yeah.
What is that?
All right.
What is melting?
So the melt method is a method that uses like a specialized soft foam roller and some soft balls to address the fascial system. And so just recently, like within the past, say, 10 to 12 years, the fascial system has gained more kind of relevance in the medical field as how important it is to have a healthy fascial system. And what fascia is this connective tissue that just runs throughout your whole body, allows your muscles to slide and glide and move, your organs to kind of also, it encases all your organs, and it plays an important role in the body. And so when the fascial system isn't healthy, it can affect many systems of the body. But one easy example of what like an unhealthy fascial system is, or not even a system, fascial tissue is, or two examples I'll give, is one, if you have a like a marathon runner, or somebody new into running. You run, and you start the repetitive motion, the body just kind of starts to break down, and you either could get an ache or pain, or you might feel a stiffening in the body, and then you feel like you're running through peanut butter. You're running in peanut butter. So that is kind of like the fascial system getting dehydrated because of the repetitive motion.
Mm-hmm.
And so another example of that like dehydrated connective tissue is, say you wake up in the morning and you get out of bed and you're really like just kind of stiff. Mm-hmm. Or you've been on a long car ride and you stand up and your hips are stiff. That's again, you're from sitting in a prolonged position, just the connective tissue has become kind of dehydrated and stuck in one position. So the melt method uses the roller and the balls to release and then kind of rehydrate and bring fluid back into that area. So I do it here like one-on-one sessions with clients, and then I also offer like a class in the evening.
Sort of an introduction to the principles.
And then it's for people to learn how to do the melt method and then take it out on their own. Mm-hmm. And it's something that's easily done every day on a daily basis on their own at home. Yeah.
So it sounds like the way you described it, melt is a restorative modality?
It can be both. So it can be both. It can be used for many different reasons. Okay. It could definitely restorative. That's usually the number one reason why people use it.
Yep.
But it also can be used to enhance somebody's like motor neuromuscular performance. Because the nervous system is housed within the fascial system, there's like a neural component to it, and obviously the nervous system is kind of like what controls all of our controls everything, controls all our movements. So people can melt prior to an event or prior to a training session to get more out of their training session.
Is there any way to make melt strenuous as a total fitness system?
Melt is always evolving,
okay.
And so yes, there's different components to melt, and so it's about releasing and rehydrating the nervous system. But there's also about a part of melt that is to reintegrate movements back in, and that's using TheraBands and specific exercises.
Yeah.
So yeah, there's different levels of melt. So it can be hard, maybe not to where you're completely sweating, but you're fatigued in doing some of these exercises because they're holding patterns and then reintegrating the movement.
Sometimes patterning work, nervous system challenge is very draining, but in a different way.
Exactly.
Well, that's all the questions we had. do you have anything you'd like to say to someone who really needs your help?
Come. Come. Just feel confident in, that we would come, we would love to work with you, and feel confident in me that, like, if you're afraid to, come in and exercise, or you don't know where to start, we take it, we can break it down, take it right from the beginning, ease you in slowly, and I love working with those type of clients, because it's just so much fun to get them over their fear of starting to exercise, or fear of re-injuring themselves. And like I said, I would just have you come in, and like I said, we'd start off slow and progress you as you can handle it.
Yeah, I mean, I want to toot your horn a little bit. Beth has been working with a runner who has some serious structural issues related to pelvic floor and fascial restrictions. And when a physical therapist came to me saying, who's the right fitness coach or performance coach for this guy, and it's totally Beth. She's done a great job in guiding this guy back to returning to a regular running routine, hopefully avoiding surgery. It's a pretty serious condition, but you've done a great job with him.
Great, thank you.
I have total trust in you.
Thank you.
Okay, that's it for today. Thanks for joining us. We'll be back again next week for episode number 10 of Elite Extra, Extraordinary Life Support for People Who Lead Extraordinary Lives. We'll see you then.
Bye.
Finish button on my
I presume it's off.
There.
There.
No, it's not off yet.